guys, welcome back to Medical Coding with Blue. Today's episode is all about filling out productivity reports for medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a comment. I'm going to read the comment and then we're going to get into it. So here we go. The viewer says, I have had my coding certification for a few years now, but just recently got hired as an emergency department coder. I never knew that there was a log that needs to be filled out to account for downtime. Is that something that is customary? Not a big deal. It's just I've never heard anyone mentioning it. So every facility and every place is going to be different when it comes to logging productivity. And for some facilities, they are going to have you fill out a report where you put in how many encounters you coded, or if you are on the inpatient side, how many records you coded, and you put in there how many encounters you coded, and then if you had any downtime. And downtime meaning if you were in meetings, that's taking you away from coding. And so they're not going to count that time against you, because in an 8-hour day, if you are away at meetings for 2 hours, they're not going to expect you to, if you have to do 12.5 per hour average, because if you have like 100 as your productivity standard for the day, the average, that's 12.5 per hour in an 8-hour day. And they're not going to expect you to put like 25 encounters over 6 hours, adding that on to the 12.5 that you're supposed to do average per hour. They're not going to make you do that, because your average per hour is supposed to be 12.5. So with this, you are to document the time that is downtime, or the time that you are not able to code, so that they don't count that time against you. Now, if you're going to meetings and you're not putting that on your productivity report, and you're saying in a day that you did 60, and it's in a 60 and 8-hour day, they're like, okay, what's happening here? You're falling behind. Why did you not do 40 more in this 8-hour day? What's happening here? So for some supervisors, if you talk to them, they will work with you in terms of if you have a really complex chart. Now, some people will take advantage of this and say, oh yeah, all these were hard. No, it's going to be those really special ones, very, very few and far in between. When I worked for a level 1 trauma hospital, I had one particular case that was 35 diagnoses and several different procedures. So much so that there was no more space, and I had to use a separate box in order to report everything else. And so for this one took me a good 2.5, almost 3 hours to work through everything that I had to look through. And so I talked to my boss about it, and I was just like, this one was really, really complex. And she was like, don't worry. She goes, go ahead and mark your stuff down for 3 hours of downtime for just this one record, because she goes, this was a lot. And it was really a very complex record. And that was one of the most complex records I have ever done. And I've done some pretty complex, gnarly things, but this one was really serious. So with that, I was like, okay, good. So what that means is I had 3 hours to devote to this one particular record, because it was an unusual circumstance. This was not a regular circumstance, and this was not me trying to weasel my way out of meeting productivity standards. This was me legitimately coming to my boss and be like, this was a lot. And so she worked with me on that time. And again, it's unusual. It's not every day that you're going to get 3 hours to work on one, but this was, again, it was a very unusual case. So on that day, I had to show that I met productivity for 5 hours of the day. And so with that, as long as I met the productivity standards on the average per hour, let's say the average per hour was 12.5, 12.5. I met the 12.5 for those 5 hours, and I'm good to go. And it shows that I met productivity. They want to make sure that you are getting through the records at a timely pace, and that you are not dawdling. Because when coders dawdle, the backlog tends to go up and up and up, and all of a sudden you've got a backlog that's out of control. And a backlog meaning that you haven't been able to touch those. There's going to be times in your organization that you may have a huge influx of a lot of patients, and so you're not able to code everything. Let's just say, for example, you have the 100 that you're supposed to do average, but the clinic that you work in received 200 encounters in that day. Now, you're not going to be expected to hit those 200 encounters all in one day because, again, your productivity standard says that you code 100 average per day. Now, if you can do more than that, then by all means, that's great. But you never sacrifice accuracy in the name of productivity. Never. You always, always, always maintain accuracy. If it takes a little bit longer, it takes a little bit longer. Anybody who's anybody in the industry understands that, and they understand that when you have that, that you're going to, there's going to be times when you're not going to be able to meet that every single day. And it doesn't mean that you're a bad coder. It doesn't mean that you are slacking off. It just means that there are some days that things are just more complex than others. And there's going to be times when you're going to be able to fly through encounters because everything is there like it's supposed to be, and everybody's documenting like they should. And so it gets easier with time, you know, so it really all depends. But yes, they do this in order to track productivity, to make sure that everybody's keeping up with what they're supposed to keep up with. It ensures that the workload that comes in is being worked through in a timely manner. And it's not just, oh, well, I only feel like coding 10 today and that's it. You know, instead of, okay, what happened to the other 90? You know, you would have to explain something like that. And if there's things that are coming up that are like habitual, like with the systems, then they know that there's a system issue that needs to be worked with, right? If you are performing lots and lots of provider education, this is okay, I think, because it's okay to invest a little bit more time with your providers for a certain period of time to get them all on track and to get them all going in the same direction and on the right path, rather than not educating them and then all of a sudden you have to do query after query after query, because queries take time and queries actually suck time away from productivity as well. I tell my providers too, the anatomy of a query is 1 hour. And they said, well, what do you mean? I said, if I'm looking at a record and I see that there's information that is missing that is preventing me from coding out this encounter, I have to go through the query template and put in what needs to be put in, or I have to draft out the query myself and make sure that I give them those options, because you have to write a query in a format that is legal, and you want to make sure that it is right, because trust me, anybody can be looking at these that audits these records. So you want to make sure that everything is proper and that you're writing out a query like you are supposed to. So you have to either use a template if there's a template available, or you have to draft it out. And when you draft it out, again, you got to make sure everything is good on there. Then you got to send it to them. Then you got to wait for their response. So let's say that's another 15 minutes that you have to wait on them. And then they respond to you and they say, okay, they're feeling a little spicy. And they say, no, I'm not going to fix this. So then you've got to go over to their office if you're in the facility, or you've got to schedule an appointment with them if you're working remotely. And then you've got to explain to them what it is that you're looking for, or what it is that you're trying to get across to them, because maybe they're not understanding. Because sometimes they'll say, well, I don't understand this, so I'm not fixing it. And then you have to explain why, and then why you're giving them these options, and why these options are valid based on the documentation. You know, this is why you're giving them those choices, and then they can write in whatever they want to in this response to the query. So that's another 15 minutes, you know. And so then they have to go back and fix it. And then once you guys sort that out, and depending on how long that takes, but let's just say for numbers' sake, it takes another 15 minutes. So sending it, waiting for the response, them responding, and then them fixing it. That's another 15 minutes. And then you have to go back and check and look. Again, that is 1 hour for one encounter. This is why I say that if you spend time educating your providers so that you don't have to do all these queries, it's even better. It's more efficient, even though on the front end, it looks like you're spending more time. On the back end later on, it's going to be a lot more efficient, because then you're going to be able to get through these encounters much more quickly, because then they're going to understand, okay, when they have an injury, it's important for the coders to know where this patient is if the patient had a surgery, because they're going to know if this is a post-op appointment or if it's not in the global period, or what happened here. They're going to know this. So they're going to know how to knock these codes out appropriately because they will know where this patient is in their care. So because of all of this, that's why educating them on the front end so that we don't have to take care of this on the back end is a good idea. And that's just why I say it's better to have more time with education than more time with queries. Because if you're having to send out query, and you say, oh, well, I sent 20 queries today. Okay, no, that's too many queries. That means those providers need education, and you need to get in there and educate them. Or the person who does the education needs to get in there and educate them, because there's something that is missing. And you're always going to have that time that gets taken out because they don't know what they're supposed to be doing, or they're just running wild and coding, or not coding, but documenting whatever way they want to with lacking detail. So that's the thing. It really all goes to that. But those productivity logs are going to tell leadership what is causing coders to have downtime, because the whole goal is for them is for the coders to be coding and to keep that productivity. Okay, we're getting these things coded so we can send them off to billing, and billing can send them off for payment. And they need to be done in a timely manner. So if we're looking at these productivity reports, we can see, okay, there's a lot of queries going on, so we're going to have to make sure these providers get educated. There's a lot of downtime because there's computer problems, so we need to either get updates or we need to get better equipment. So there's a lot of information that can be gleaned from these productivity reports. But again, it can also tell the supervisor, okay, this person's getting a lot of workload in. Maybe we need somebody to come in and help them out because there's more encounters in this particular clinic for some reason. And we need support here. So there's always a lot of things that can be found out with these productivity reports. But yes, it's very important that if that's what you're doing, that's what you've got to make sure that you put on there. Now, bathroom breaks and stuff like that, you don't put those on there. That's not what those productivity reports are for. It is literally just for like the big things. If there is a really difficult chart, you need to go and talk to your supervisor about it. You cannot just arbitrarily, take yourself 3 hours to work on this one because it was really complex. You have to talk to your supervisor first before you do that. Put that on your workload, okay? But if you are doing education with your providers, make sure that you put that on there. If it's 15 minutes, if it's 30 minutes, obviously don't put it down if it's 5 minutes. If it's 5 minutes, it's 5 minutes. That's not enough to impact your productivity. 5 minutes is not going to impact you at all. And so you really want to look at things that are taking you more than 15 minutes, because 15 minutes in an hour time, right, is going to impact you. So that's why you want to make sure, was it a half an hour? Okay, but then that's what you want to go ahead and put on your workload. If you did 35 minutes, it's a half an hour, okay? If you did 40 minutes, it's 45 minutes, right? So you just want to make sure that you round up to the nearest half hour or round down to the nearest quarter hour, whatever, and just kind of keep it that way. But really make sure that you watch how much time that you're spending on these other things. If they know that you're using it to just take advantage, like all of a sudden every single day now, you have something on your productivity log that's that you were doing that's not coding, and it's really more of a choice type deal, then they're going to be like, okay, now it looks like you're taking advantage. So use it wisely, your downtime. Obviously, if it's for like some facilities, they have you do education for the facility itself. In my instance, We have education that we have to do that's for like safety, like falls, like making sure that you know not to walk in water because you will slip and fall, where to go if there's a fire, if there's like another like a natural disaster type drill, where to go on the facility grounds and that kind of thing. So those are things that we have to keep up with. HIPAA is another thing that we have to keep up with. And so with all of those things, that's natural to be able to put on to your workload report, because that's something that the facility knows that they're going to have to, give the employees time for, okay? Because you have to work in your assigned time. You can't be doing this off the clock willy-nilly because they're paying you. And when they agree to pay you, they agree to pay you and they agree to educate you on the clock. So that's something that you got to know. But that's why we have work logs. So that way they know where the time is being spent. And again, it tells them if some area needs improvement, or if there's a process that could be improved that would help to make that area more efficient. That's also what can be found out on those workload reports. But it really takes leadership looking at those and the coders being honest with where their time is going, in order to get that stuff on their right, So there's times when I have providers that stop by for a quick question. I'm not going to charge for that time, essentially, because if it's less than 5 minutes, it's less than 5 minutes. But sometimes it does get long. Sometimes it's 45 minutes. Sometimes they catch me and it's 30 minutes because they have limited time that they can catch me, or maybe they just have a time between appointments or something like that. And it just so happened that they had a slot open up and there's nobody there. Hey, Blue, I have this question while I have some time. Well, now we have that time together. And so that's always going to be a priority. Any coder that knows the importance of doing that is going to jump right on that time, because again, that time is so scarce a lot of times when they have, some downtime that they can come and talk to you. And again, to be able to squeeze in any concerns that you have, that you've seen from their documentation, that's a great time to bring it up. Because a lot of times they'll say, well, how's my documentation going? And they will be genuinely interested in these types of things, because this says to them if they're doing things right or not. Because a lot of times providers will say, I don't know if I'm doing things right or not, because no one has said anything to me. And I said, well, no news is good news, right? That's the way I used to think. And they were like, yes, technically that is true, Blue, but it would be nice to know, am I doing this right? Getting that confirmation would be a great thing, And so I said, okay. So that's how I started learning that providers need that. They need that reassurance as well. Because even though they are the alpha in the facilities, these providers, because obviously they treat the patients, but we're the ones who ensure that they get paid appropriately for the services that they're providing. And so we want to make sure that we account for our time, and we account for time educating them as well. So again, I mean, it's that's why they do it. And another person commented, which I was really appreciative of, because I like this answer. They said, I worked in auditing and we had a log for things such as system outages, computer malfunctions, etc., things that prevented us from working that was out of our control. Some education and meetings were included too. Check with your manager. Sometimes extra complex cases too, just like I mentioned. So, because like I said, that happened to me. But that's why they do it. And it is a very informative piece. And it's not going to be something that you have to come up with. My supervisor, it was the one who did the Excel spreadsheets. So they're the ones who figured that stuff out, but my supervisor did ours for our team. And she calculated the productivity that we're supposed to do average per day, and then it'll change colors. So what we do is we put in our time, we put in how many we did, And then I don't know how she did it, but she made it to where it calculates, and then it'll change color. If it's green, then we did our productivity for the day. If it's red, it'll say, you know, that we didn't do our productivity for the day. If it turns purple, that means we exceeded our productivity for the day, which you always want to get to purple. You always want to get to purple, but it'll average it out, and then it'll average it out for the end of the week. So even if you didn't meet your productivity for whatever reason, meetings, education, whatever, on a certain day, and you just happen to fall under, because it is kind of hard sometimes to get going in the coding when you have to stop and you have to stop again. I hate that. You know, that drives me nuts. Whenever we have our education, we have it once a month. Sometimes they'll double book us on meetings. So it'll be a meeting about that, our education, and then it'll be a team meeting about something else. And so you're essentially start your day, stop your day, start your day, stop your day, start your day. And then it's just like, oh. And so sometimes I don't even meet productivity. I'm like, okay, you know, I'll just make it up tomorrow. And then I do. And so sometimes that's just the way that it is. You know, like I said, not every day is going to be the same. Every day is going to be different, especially if you have a specialty clinic. Now, if you have a clinic that's more the same, a monotonous clinic, then you may be able to reach it no problem. But if you're working in a specialty clinic like the ER or something like that, cardio, ortho, you know, you're going to see that it may be a little difficult to do that in a day. So, and then you just start again the next day. I mean, that's all you can do. But as long as you're showing that you keep going up and that you're not consistently going down in your productivity, you'll be fine. So if you don't meet your productivity, don't worry. But yeah, that's why they do it. That's why they do it. There is a reason for everything. And the more you document things, you journal them, you know, like basically with the productivity reports, the better off you'll be. Because if something happens, you'll know, and you'll have a record of, okay, what happened on that day. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.